Hi.
Hi, my name's Brianna. I'm a nurse practitioner. Excuse me, I just finished washing my hands. They might be a little bit wet.
It's nice to meet you.
Nice to meet you. What's your name?
I'm Samaya.
Samaya. And how old are you?
I'm 20.
You're 20? Okay, and do you identify as
Female.
a female? Okay, and what about your ethnicity?
Black.
Black? Okay, excellent. And what brings you in today, Samaya?
My eye is like pink and it's itchy and it hurts.
Oh no, okay. How long did this start?
It started about 8 days ago.
About 8 days ago?
Mm-hmm.
Okay, and where is the itchy
It's on like
pain?
the corner of my eye.
On the corner of the eye there. Okay. How long does this last for?
A couple of hours.
About a couple hours?
Yeah.
Okay. And if you had to describe what you're feeling in your eye, what would you describe it as?
Like a stinging pain.
A stinging pain?
Yes.
Okay. Is there anything that makes it better?
Putting a warm towel on it.
Okay. What about anything that makes it worse?
Going out in public and like going out in the air and stuff.
Oh, okay. All right. And does the pain radiate to other places on your body?
No.
Okay. And when did you notice this started to happen? Like time of the day?
Like in the morning.
In the morning? Okay. And how severe is it if you had to rate it on a scale from 0 to 10, 10 being the worst, 0 being none at all?
At 8.
An 8?
Yes.
Oh no, okay. And is it constant pain or?
Yes.
Constant? Okay. Any other symptoms that you have going
No.
on? Okay. So it's just the itching and the pain?
Yes.
Okay. Is it pink?
Yes.
It looks pink. Okay. Any like drainage from the eye?
Not that I know of.
Okay. And what do you think is going on?
I think it just might be pink eye.
Pink eye?
Yeah.
All right. I'm just gonna ask you a few questions about your past medical history.
Okay.
All right. Have you ever been hospitalized before?
No.
Have you ever had any surgeries?
No.
Have you ever had any traumas or injuries?
No.
Have you ever had any like flare-ups of pink eye or other like illnesses before?
I had pink eye once before.
Pink eye once before? Okay. Any occupational illnesses?
No.
Okay. Do you have any chronic medical conditions?
No.
Okay. Have you ever had a history of cancer?
No.
What about alcoholism?
No.
Heart disease?
No.
Hypertension?
No.
And diabetes?
No, ma'am.
And what about asthma?
No.
All right. Now we're going to move on to your family history.
Okay.
Do your parents or your grandparents or your siblings have a history of cancer?
No.
What about alcoholism?
No.
Heart disease?
No.
Hypertension?
No.
Diabetes?
No.
Asthma?
No.
Okay. All right, now we're going to talk about your social history.
Okay.
And what kind of job do you have?
I'm a nurse.
Okay, what kind of nurse are you?
I am a pediatric nurse.
Awesome. What kind of hours do you work?
I work from like 8 to 6 or 5.
Okay, is that a day shift?
Yes.
Okay, how many hours do you work?
Between 40 and 50.
40 and 50 hours?
Yes.
Oh, a lot of hours.
Yeah.
Are you married?
No.
Do you have any children?
No.
And where do you live?
I live in Ipsy.
In Ipsy? Okay. And do you live in a house?
An apartment.
An apartment?
Yes.
And do you have any legal issues going
No.
on? Okay, do you feel safe in your home?
Yes.
Do you have enough food to eat?
Yes.
And do you have any stressors going on in your life?
No.
And how are you coping with everything going on?
I work, I hang out with friends and family.
Good. Alright, now let's move on to your psych history.
Okay.
Have you ever been treated for any mental condition?
No.
Are you currently being treated for a mental condition?
No.
Have you ever been hospitalized for a mental condition?
No.
Have you ever thought of or attempted suicide?
No.
Have you ever had any, have you ever intentionally hurt yourself?
No.
Ever intentionally cut yourself?
No.
Okay, now we're going to move on to your substance use.
Okay.
Have you ever been treated for the disorder of alcoholism?
No.
What about, have you ever been treated for the use of opioids?
No.
Okay, what about for the use of stimulants?
No.
Use of THC?
No.
Okay. Awesome. Do you have a history of hepatitis C?
No.
Okay. Now we're going to move on to your gynecological reproductive history. Have you started your menstrual cycle?
Yes.
Oh, how old are you, by the way?
I'm 20.
You're 20. Okay. And how old were you when you started your period? 10. Okay. How frequently do you get periods?
Every month.
Every month? Okay.
Yes.
And how long do they last?
About 5 or 6 days.
Okay. And when was your last menstrual period?
Like a week and a half ago.
Okay. Are you sexually active?
No.
Okay. Do you have a history of sexually transmitted infections?
No.
Okay. And do you identify as a male or female?
Female.
Are you currently on birth control?
No.
Have you ever been pregnant?
No.
Okay. Now we're going to move on to your current health.
Okay.
Do you have any medication allergies?
No.
Do you have any environmental allergies?
No.
Do you have any food allergies?
No.
Do you have, do you take any prescription medications?
No, ma'am.
Okay. Do you take any over-the-counter medications?
No.
Okay. Do you take any herbal medications?
No.
Do you take any supplements?
No.
Okay. Do you chew tobacco?
No.
Do you vape tobacco?
No.
Do you smoke tobacco?
No.
Okay. Do you do any recreational drugs?
No.
Do you do any IV recreational drugs? Any oral or nasal recreational drugs? Do you drink alcohol?
No.
Okay. Are you up to date with your immunizations?
Yes.
Did you get your flu shot this season?
Yes.
And what type of diet do you have?
Normal and like various.
Regular diet? Do you eat a lot of vegetables?
Yes.
Okay. Do you eat meat?
Yes.
And do you drink caffeine?
Sometimes.
How many cups of caffeine do you have a day?
I only have like 2 or 3 cups a week.
Okay. Do you exercise?
Yes.
What kind of exercise do you do?
Cardio.
Cardio?
Yes.
And, okay, how long do you exercise when you do your cardio?
About 1 or 2 hours.
Nice. Do you sleep well at night?
Yes.
How many hours of sleep do you get?
Between 8 and 9.
Okay, and do you feel rested when you wake up?
Yes.
Okay. All right, now we're going to move on to like just reviewing each body system. There's a few questions there. Have you noticed any weight changes?
No.
Okay. Have you noticed that you've been feeling fatigue?
No.
Any fevers?
No.
What about chills?
No.
Difficulty sleeping?
No.
For your skin, have you noticed any rash?
No.
What about any lumps?
No.
Any sores?
No.
Any itching?
No.
Any dryness?
Nope.
What about any color changes?
No.
Changes in your hair?
No.
Changes in your nails?
No.
And any growths on you?
No.
All right, for your head, ear, guys, nose, and throat, have you noticed any headaches?
No.
Have you ever had any injuries?
No.
Head injuries?
No.
Have you ever had any dizziness?
No.
Okay, for your eyes, have you noticed any vision changes?
No.
Have you, so I see you wear glasses, do you ever wear contact lenses?
No.
Okay, and do you wear those glasses all the time?
Yes.
Okay. When was your last eye exam?
A couple of months ago.
A couple months ago? Okay. Do you have any eye pain
No.
besides the right eye pain
Oh,
that you're
except-
having
yeah.
right now?
Except for that.
Okay. What about any eye redness?
Sometimes.
You have that. Look like you have a little eye redness right now. What about excessive tearing?
Only when my eyes flaring up.
Okay. Only when your eyes flaring up. Any double vision?
No.
Any blurred vision?
Only when my eyes flaring up.
Only when your eyes
Yeah.
flaring up. Okay. And any vision? Any eye discharge?
No.
No. And how often do you get like the flare ups with your eye?
Like a couple times a day.
Oh, okay. How long does that last?
A couple of hours.
Wow. Okay. All right. Let's move on to your ears.
Okay.
Have you noticed any hearing changes?
No.
Any ringing in the ears?
No.
Any ear aches?
No.
Any ear infection?
No.
Any ear discharge?
No.
Or any external ear pain?
No.
Okay. What about for your nose and your sinuses? Have you noticed any congestion in your nose or in your sinuses?
No.
Okay. Any discharge from your nose?
No.
Sinuses? Any itching?
No.
What about hay fever?
No.
Nosebleeds?
No.
For your throat, have you had any bleeding in your gums?
No.
Do you wear dentures?
No.
When was your last dental exam?
A few months ago.
Okay. Do you have any tooth pain?
No.
Any sore tongue?
No.
Any dry mouth?
No.
Sore throat?
No.
What about hoarseness in your throat?
No.
Difficulty swallowing?
No.
Okay, let's move on to your neck.
Okay.
Any lumps in your neck?
No.
Any swollen glands or goiter in your neck?
No.
And what about neck pain?
No.
Any neck stiffness?
No.
Okay, we're gonna move on to your breasts. Have you noticed any lumps in your breast?
No.
Any pain?
No.
Any discomfort in your breast?
No.
Any discharge from your nipples?
No.
Okay, we'll move on to your lungs.
Okay.
Have you noticed any cough?
No.
Okay, any pain with your breathing?
No.
What about any wheezing?
No.
Snoring?
No.
Okay, what about any pain, like just when you breathe in and out, like around your lungs?
No.
All right, we'll move on to cardiac. Have you noticed any chest pain?
No.
Any chest discomfort?
No.
Do you ever feel like your heart is like beating hard in your chest or fast in
No.
your chest? Any edema or swelling in your legs?
No.
Okay. Do you ever get like passing out
No.
at all? Okay. Any wounds
No.
on your legs?
Mm-mm.
Any leg pain?
No.
What about varicose veins?
No.
Okay. Do you have a history of blood clots?
No.
Okay. Awesome. Now let's talk about your stomach, your GI. Have you noticed any appetite changes?
No.
Okay. Any yellowing of your skin?
No.
Okay. Any nausea or vomiting?
No.
Okay. Do you have any heartburn?
No.
Any stomach pain or
No.
belly pain?
Mm-mm.
What about like excessive belching or excessive gas?
No.
Okay. Any changes in your bowel movements?
No.
Okay. Any blood in your stool?
No.
Do you have hemorrhoids?
No.
Are you ever constipated?
No.
What about diarrhea?
No.
Okay. And are you able to tolerate all the foods that you eat?
Yes.
All right. Let's talk about your urine and your genital area.
Okay.
What are your sexual habits like?
What do you mean?
Do you have sex?
Oh no.
Okay. Are you interested in sex?
Not really. No.
Are you okay? So the rest of these questions don't apply to you because you don't have sex.
Okay.
Do you use birth control?
No.
Have you ever had HIV?
No.
Okay. Do you wake up at night to pee?
No.
Okay. Do you pee a lot?
No.
More frequently than you feel like you normally do?
No.
When you do pee, do you feel like it's urgent or you have to rush to the bathroom?
No.
Okay. Does it hurt when you pee?
No.
Do you have pain or do you have blood in your urine?
No.
Have you ever had an accident on yourself, like
No.
when you pee? Okay. When you do urinate, so we talked about your period already, but just want to make sure we cover all the bases. How frequently do you have your period?
Every month.
And how long does it last?
About 5 to 6 days.
Do you have pain with your period?
Just in the first couple of days.
Okay. What about any PMS symptoms?
No.
Okay, do you bleed in between your period?
No.
Okay. And your last menstrual period was how long ago?
Like a week and a half ago.
Okay. Do you have any vaginal discharge?
Sometimes.
What does it look like?
Clear.
Just clear?
Yeah.
Okay. Any itching?
No.
Any sores on your vagina?
No.
Any lumps?
No.
Okay. And you're 20 years old, so you're not in menopause.
Yes.
So we'll move on. Okay, so for your muscles, do you have any muscle or joint pain?
No.
Okay, any joint stiffness?
No.
What about joint swelling?
No.
Okay. So let's talk about like your mental status.
Okay.
Have you ever had any like passing out episodes?
No.
Any seizures?
No.
Any weakness in your muscles?
No.
Have you ever went number tingling on any of your like extremities?
No.
What about like have you ever just wasn't able to walk, like went paralyzed?
No.
ever had tremors?
No.
What about like moving without controlling it? Were you
No.
like twitches? Any dizziness?
No.
Okay. Any issues with difficulty balancing?
No.
Okay. Okay. Do you bruise easily?
No.
Do you ever had a blood transfusion?
No.
Do you bleed easily?
No.
Okay. All right. Now we're gonna move on to your hormones. Are you able to tolerate when it's really hot?
Yes.
Okay. What about when it's really cold?
Yes.
Okay. Do you ever have excessive sweating?
No.
All right. Do you ever have like excessive thirst?
No.
What about excessive hunger?
No.
And are you you ever had where you pee more than you normally would pee?
No.
Okay. What about any weight loss?
No.
Any weight gain?
No.
Okay. So now we're going to move on to the actual physical exam part of our visit today. So I'm going to go wash my hands. I'll be right back.
Okay.
Okay, just got finished washing my hands. So I am noting your general appearance. She is an African American female. She does not appear to be in any distress. She looks very calm and she is dressed appropriately. So I am just gonna inspect your head and just feeling on the skull. There's no lumps, no bumps. Her head is symmetrical. Is there any tenderness
No.
on your head?
No.
Okay. So for your facial expression, could you give me a nice big smile? Okay, great, beautiful. Her facial expression is appropriate and it is symmetrical. And I don't see any abnormalities in her facial expression. And I'm going to touch the back of your jaw.
Okay.
Okay. Can you open your mouth? Open, close, open, close. Okay. I don't notice any clicking or any any tenderness back there when I touched your jaw. So there's no tenderness there at all. No swelling back there either. Let me look back to see if there's any redness. Is it okay if I touch your hair?
Yes.
I'm so sorry. Okay, there's no redness on either side of her jaw, so her TMJ looks within normal limits. And her range of motion is very smooth for her TMJ as well. So yeah, no swelling or tenderness in her TMJ. Now we're gonna move on to your neck. I'm just gonna palpate around your neck. So her neck is also very symmetrical. I don't see any scars or any masses on her neck. Just looking at your trachea there is very midline and it does not deviate to the left or to the right at all. I'm just gonna inspect your thyroid now. Can you swallow for me? Swallow one more time. So her thyroid is very smooth, there's no nodules, there's no swelling, and it is symmetrical, and I was able to palpate her thyroid. And can you move your head up and down and side to side? Any pain with your neck movements?
No.
Okay, so there is no pain with her range of motion, and her range of motion is full and it's smooth. So yeah, we have already looked at her lymph nodes, and the consistency is smooth. There was no tenderness. The shape was symmetrical. I did not notice any lumps. Now we're going to move on to your cervical spine. I'm just going to palpate your cervical spine. Any tenderness there?
No.
Okay, there's no swelling, no redness behind the neck. and it is midline. Her cervical spine is midline. Okay. Just going to palpate your cervical muscles. Any tenderness there?
No.
Okay, so no tenderness, and it is symmetrical, no spasms. Alright, I am going to just listen to your thyroid just to make sure there's no blood rushing there in the thyroid. Okay, I don't hear any bruits or any excessive blood flow in her thyroid. Okay. Now we're gonna move on to her ears. So I'm just gonna look at her ears so I don't notice any deformities. They are symmetrical, no scars, no discharge, and no masses or skin lesions on her ears. I'm just gonna do a quick a whisper test. So when I say three letters or numbers, I'm gonna whisper it, and then you say it after I say it. Okay?
Okay. 2, 4, 8. 6, 4, W.
Okay, so her hearing is intact. She passed the whisper test very well with flying colors. So now we're going to move on to her optic exam. So in order for me to use an otoscope, I would look at her right eye with my right eye, and I would dial the otoscope appropriately so that I could see her through her pupil correctly based on my vision, and I would shine it into her pupil, and I would look for her optic disc, looking for any papillary edema. So I'd go like this and just shine it on there, and I would do it on both sides. Oh, that was for the eyes. Oops, I meant for the otoscope. But that's for the for the eye exam. But for the otoscope, what I would do is get the little disposable piece over it, pull the ear back, and look into the eye, and look for into the ear, and look into her ear and look for any discharge, any excessive cerumen, any obstructions in the ear, and looking for the tympanic membrane, and the membrane should look like a grayish clear. And I would do the same on this side. Just gently just pull the ear back and then look into the ear, and make sure that the ear canals are patent. So I would look for any foreign bodies, any erythema, any edema, any masses, anything that is not normal. And then for the tympanic membrane, I would note the color, and then also the cone of light on the tympanic membrane et al. For the hearing loss, there's two different tests that I could do with a tuning fork. There's the conductive versus the hearing, for the hearing test, the conductive versus the air test. So I would take the little tuning fork and put it on my arm to cause the little brackets to move, and then put it on top of her head, and she would tell me when she doesn't hear the noise from the tuning fork anymore, Then after that, I would put it on the outside, making sure I'm watching the time on the outside of her ear. And then when she doesn't hear it anymore, then we know that the air conduction is longer than the sensory conduction, or meaning the bone conduction, because, and that's what we want. So now we're doing the same thing on this side, you know, activate the tuning fork, put it on top of her head, and then put it outside the ear to see if it was the same on both sides. So we want the air conduction to be longer than the bone conduction. Okay, and yep, her ear, the external part of her ear does not have any deformities, it is symmetrical, it doesn't have any masses, any scars, skin is intact, everything looks normal. So now we're gonna move on to her nose. I am going to palpate her nose for any soreness, any tenderness, any soreness or tenderness?
No.
Okay, so no tenderness. Then I'm going to look up her nose to see if it's patent or not. Yeah, nice and patent. The nasal membranes don't have any erythema, any discharge, no swelling. I'm also going now to palpate her maxillary and frontal sinuses. Do you have any pain
No.
with that? So no tenderness or swelling in her sinuses. Now we're going to move on to talk about her nose. So the color in her nose, it was pink, it was no swelling, there was no bleeding, there was no like drainage coming from it. I didn't notice any ulcers or polyps in her nose. And in order for me to do her the otoscope, I would take the otoscope and then put it in her nose and inspect the membranes of her nose that way. So her septum is not deviated at all, and it's not perforated. When I inspect it with my pen light, her septum is not deviated. It's all within normal limits. All right. So now for her mouth, when I inspect her mouth, you gonna look at your mouth. You can keep your mouth closed for now. Her lips are moisturized and not dry. The color is pink. I don't see any lesions, no cracks in her lips. So now you can open your mouth. Okay. So the color of her mucous membranes are pink. I don't see any areas of odd or irregular pigmentation, no ulcers or patches on her mucous membrane, and no nodules. Okay, let's look at your gums. Can you smile for me? Okay, so the gums are pink and brown, and I don't notice any ulcerations on her gums. They're not bleeding and they are not retracted. Let's look at your teeth. Can you say ah? Okay, her teeth are all present. They are white. They are positioned properly and none of them are missing. I guess I'm supposed to touch your lips. So her lips don't have any lesions. They're soft. I don't see any masses on her lips. All right, for her tongue was pink. I didn't notice any lesions on her pink, and the texture was smooth. For her pharynx, can you say ah for me one more time? Okay, her pharynx is nice and pink. There's no swelling, no lesions, and it is symmetrical. For her uvula, it did raise when she said ah. Her tonsils, they are not swollen. I don't see any ulcers, and they are symmetrical, and she did not have any exited from it, and I would rate her size as a 3 out of 5. Now we're gonna move on to her eye exam. So let's look at your eyes here. Okay, so her eyes, the color, or they're dark brown, her pupils are equal round and reactive. So first what I wanna do is I want to, I'm gonna test her visual fields and also, yeah. Check your visual fields. Okay, so can you cover your eye with this eye with that eye? Yeah. Okay, and look at my nose. Okay, how many fingers am I holding up?
2.
Okay. And then what about now?
1.
Okay. Make sure you look at my nose. What about now?
3.
Okay, good. We're gonna do the same on the other side. How many fingers am I holding up?
1.
Okay. What about now?
2.
And then what about now?
3.
Okay, so all of her fields of vision are within normal limits. If I did have a color eye to check to see if her eye color or color vision was intact, I would do it at that time. Alright, now I'm just gonna look at your eyelashes and your eyelids.
You make me take my glasses off.
Yeah, if you could take your glasses off, that would be helpful. Alright, eyelids don't have any edema, any discolorations or any masses. Her eyelashes are all present. Very beautiful. No lesions on her eyelids as well. For her, I lost my spot here, excuse me. For her lacrimal appearance, they're pink, non-swollen, no lesions there. The color of her sclera is white. There's no swelling, no discharge from it. But a little bit on the right side, there is a little bit of redness on the sclera, and that's what she came in for her appointment for today. Their cornea is within normal limits, and the lens looks normal. Can you take your glasses off for me, please? Just gotta go ahead and look straight. Okay. So her cornea and her lid and the lens is clear, and it looks like it is intact. I looked at her pupils already. The size was a 3, and the shape was round. They were symmetrical, and they were reactive to light, and they were able to accommodate when I used the pen light on it. I did notice a cornea light refraction. Let's look one more time at your light. Yep. Yeah, she definitely has a corneal eye reflection in the pupils there. Okay, now I'm going to just test her extraocular movements. Okay, so just follow this pen light where I put it, okay? So her ocular movements are symmetrical. I did not see any nystagmus. No, her gaze was conjugate, and there was no lid lag. So I would do the cover on cover test to check for a deviated eye. Okay, in order for me to use a ophthalmoscope, I would darken the room, and I guess we can pretend to do it. And go the blinds. I would darken the room and ask the patient, I would ask her to focus on the wall in the distance. And I would examine on the right side for my right, I would look at her right, and I would then use the same eye, and I would hold that ophthalmoscope about 15 degrees from the patient's eye, about 15 inches away, and I would look for any red reflex and move closer to the patient to focus out the ophthalmoscope. In order to adjust the diopter, I would use the little the knob on the side, and then in order for me to brace the ophthalmoscope on her cheek, I would use my thumbs and my fingers to brace it against her cheek so that it wouldn't move, and I would have it anchored there. And then I would inspect the optic disc for color, the clarity, the size, the symmetry of both eyes, and I inspect the retina. I also look for the arteries and veins in the eye, and then look for any hemorrhages or any exodus or any lesions. And I would do the same on this side, going about 15 degrees, and then focusing the ophthalmoscope with the knob on the side, and then bracing my fingers against her face, and looking for what I needed in that eye as well. Okay, so now we are going to move on to the skin parts of her of the exam. Alright, so I'm just gonna look at your skin. Alright, can I see your arms? The skin on your arms. So I've already looked at the skin on her neck and her face during the head, ears, eyes, nose, and throat exam. The skin on her arms. And then can you roll up your legs for me? Okay, good. Down the other side. Okay, so her skin color is brown and is within normal limits for her ethnicity. Okay, I'm gonna look at your fingertips. Good. Okay, the fingertips are, I don't notice any clubbing or any disorders there. They are like a light tan. And we look at your lips. Okay, the lips, we looked at those, and they're pink and they look normal for her ethnicity. Let's look at your tongue. Tongue is pink as it ought to be, symmetrical, no lesions on the tongue. And let's look at your feet. Okay, her feet, the skin on her feet looks normal, as it looks brown as it ought to be, and there's no lesions or discolorations or swelling. Everything on her feet looks good. Okay, now when I look at the skin on her trunk, I don't see any areas of hyper or hypopigmentation around her neck. I don't see any discolorations there as well. I'm looking at her extremities as well. I don't see any areas of discoloration or any areas of hypo or hyperpigmentation. Now I'm going to look at her hair and her scalp distribution. The hair is distributed evenly, and you don't have any. Do you have any? She doesn't have any like lesions on her scalp. Her nail beds. Let's look at your nail beds. The nail beds are flat. They're tan. There's no lesions. It's the same on both. And for her toes, the same for her toes. The toenails are flat. There are no lesions. They're round. Both the fingers and the hands are round. There's no evidence of clubbing. There's no lesions, no colors. All is well for her nails and her toenails. All right, let's look at the palms of your hands. The palms of her hands are pink, no lesions. Let's look at the soles of your feet. Soles of the feet, those are also like a pinkish, tannish color. And there's no sores, there's no swelling. I'm looking for any moles or nevi. She actually does not have any anywhere. Let's look on the back. If I were to notice any nevi, what I would do would note the appearance of it with the ABCDE acronym. A being the appearance, B being the borders, if it was symmetrical or not, C the color, if it had multicolor, D the diameter greater than 5 centimeters, and then E is it evolving. If it had 3 of those characteristics out of the 5, then I would biopsy it to make sure that it was not cancerous. Now let's look at the temperature of her skin. Okay, just gonna look at the temperature of your skin for your upper extremities. All right. Fill upper and lower extremities with back again, include fingers and toes. Okay. Touching her toes. The temperature of her skin is warm. It's symmetrical on both sides, including the fingers and the toes as well. It's moist. It's not dry. The temperature, when I checked for the temperature as well, I also noticed the moisture. The texture is smooth in both the fingers and toes, and the upper and lower extremities and her fingers. The skin on her arms and the skin on her legs is moist, smooth, and warm. I'm going to assess for skin turgor on her hands. The skin turgor is expected. It is like the skin did not just stay there. It went right back into place. The turgor is good. Okay, when I palpated the texture of her hair, it is coarse and thick hair. And when I palpated her fingers, nails, and toenails earlier, okay, and that concludes our examination for today. Do you have any questions for me?
No, ma'am.
Okay. Well, it's so nice to meet you.
Nice meeting you too.